welcome to Tipsy Tooth Talk. I'm Dr. Carlin Palmer Blume.
And I'm Dr. Michelle Bishop, and I call it T-Cubed because I can't say it. But hey, thanks for joining us.
Yay, we're back. We took a little break.
We took a little break, and here's why. Listen, y'all, I went on vacation, and I went to Hawaii. And I showed up, walked into a store, and lo and behold, they had like the perfect lays for us. Check this out.
These really have rum in them, don't they?
Yeah, they do. You know what was funny? They even had them with like Tito's vodka, which I thought was funny.
Oh,
Yeah.
in Hawaii.
In Hawaii, isn't that bizarre?
So nice.
And they had tequila, but I just thought, you know, the rum was like a good choice. So today our drink is going to be a Blue Hawaiian, and we're going to talk about
Behavior management in a pediatric office.
All right. So behavior management. Let's have a drink first, shall we? So Blue.
That's what we use for our own behavior management.
Yes, but not in the office. Not in the office. All right. So Blue Hawaiians is basically rum, some cream of coconut, some. How do you say this? Blue Curacao?
Curacao?
Curacao? Is it like the
We
island?
should have looked that up.
Is it like the island, or is it
I
like
think it's Curacao.
Curacao? Listen, for today it's Curacao. Okay, and some pineapple juice. Okay, and listen, for those of you that know me in my recent Hawaiian vacation, this is like a huge iffy thing for me right now because, yeah, I know, we'll see. I kind of had a whole lot of pineapple and I kind of swelled a whole lot in my face and lips. So I really think it was the amount and not necessarily.
Maybe we should be talking about EpiPens.
Maybe so.
Instead of behavior management.
Yes, well, I have a little vial right there. Good to go. It's all safe. We're all good. I swear it was because I drank way too much and it wasn't even alcoholic. It was just a ginormous pineapple smoothie and I swelled up like a blowfish. Okay, so.
She did. I saw the picture.
Yeah, it was pretty, y'all. Okay, so we're going to add, we're going to start with the rum and go ahead and you can measure in. Let's do 3 of those.
All the way to the top, 3 of them?
Yeah.
Okay. I'm glad you didn't tell me. I want an ounce, because remember, I can't read it.
I know. That's why I had already planned.
I was sitting here thinking, oh, she's going to tell me how much again, and I'm going to ask again, and I should just memorize.
Which line it is?
Yeah. I need to study this thing.
Maybe Santa will bring you one. In your stocking.
So I can be like, oh, 1 3/4? Oh, that's this line right here.
All right, and then we're going to add 3 of the blue Curacao. Okay? If I can get this open. There we go. This is what makes the Blue Hawaiian blue.
I'm doing 3 of these too.
3 of those.
So 50-50 then. For those of you who need proportion work.
Oh, sure.
1 to 1.
Well, I was going to say it's actually 1 to 1 to 1 to 2.
I'm dripping, I'm sorry.
Oh, well, it's okay. We have some cute little napkins to sop that up. Soppy. It's all good.
So I used to live in Hawaii, by the way. Yeah, so she got to go travel and I miss it very, very much.
It was so nice. Oh, goodness. It was lovely. Okay, now, here comes the iffy thing. Oh, I couldn't find, like, I don't know. I think this stuff normally comes, like, in a can or something or a jar.
Cream of coconut?
But it looks like a mayonnaise bottle, and I'm a little scared of it, to be honest. But it's cream of coconut. That's what you need.
Yummy.
And we're going to do, oh, it just comes out like, oh, interesting. Okay. Well, it's not like mayonnaise, thankfully. Oh, well, it makes noises too.
That reminds me of, what does that remind me of?
Oh, goodness. Okay.
That reminds me of something else.
It's like Chick-fil-A sauce in coconut form. Okay, this little guy is like getting used. And then finally, let's hope for the best, the pineapple juice.
The vial, oh, it's that blue vial over there?
Yeah.
Okay.
Like, no joke, I have it. This sucker's like full to the rim here.
I'm going to be here for a while finishing this up.
It's okay. It's okay. We're gonna shaky shake. We're all good. It's all good. Okay.
Is that gonna...
Yeah, it's probably gonna leak a little. So we kind of filled this bad boy to the rim here. It's okay. We're gonna gently shake. Now, if ideally, so it's a 1:1:1:2 ratio there. I don't know what we just did. We just did a whole lot of something. We're shaking.
Okay.
It's not even leaking.
No. So I have another friend visiting Hawaii right now. His name is Easy Cortinez, and his wife Molly. They were stationed with me when I was in the Navy there,
Nice.
and then stationed with me in Corpus. And I actually did his retirement ceremony. For those of you that, we've mentioned that I was in the Navy.
Yeah.
And so he's posting pictures from 21st Dental Company and all this stuff. And really, I'm having envy between you being there and now he's there.
I needed a little more.
I'm jealous. I need to get back.
It was lovely. It was not very crowded because obviously it was October, November time frame. Little umbrella because I didn't want to put pineapple on it because of the pineapple episode. But it was lovely. I highly recommend. So, all right, Blue Hawaiians. Cheers to beautiful smiles. Let's try
Let's
this.
see.
Let's see if I pass out. I'm
It's
good.
pretty yummy.
I'm good.
I think that I would like it with the coconut that has a little bit of the coconut flake in it. Like maybe add some sweetened coconut flakes. No.
Not me. I'm not a coconut flake person.
No. See, we don't agree on everything.
Not everything. But I feel like mine needs a little more pineapple. Y'all, if I look like a blowfish tomorrow at work, good lord. Should I need more? I think yours.
No,
needs
I'm
more.
good.
Oh, well, you got some. Okay.
All right, so behavior management.
Woo!
We need to manage our own, apparently, according to our tech crew over here.
Oh, the production crew is back. Which, hey, I'm just going to give a quick shout out. Go runners. Because we were just doing this, like, for Hawaii. And UTSA, y'all, UTSA football, 11-0. Cheers, my friends. Cheers to Jeff Traylor and trusting the process because we were at that game. And oh my God, I almost died of a heart attack last night. And
I think UT needs Jeff Traylor back.
No. He's staying right at UTSA. So go runners. We'll be at that championship game. And if you watch, I have a feeling she was on News 4 last night, but the production crew got in a clip with Frank Harris, and she might be on Sports Sunday tonight. So check that out. Anyway.
Sweet. Woo.
Okay, that's my plug. All right.
So
Behavior management.
we won't really talk about the Longhorns, except they won in basketball last night and Longhorn volleyball. I mean,
Yeah.
we always have that.
Yeah.
Exactly.
Okay.
So anyway, behavior management in a pediatric office. That is why, really, a lot of that is why there are pediatric dentists, right? Trying to get, I'm sure as adults, many of you don't love having the x-ray sensor in your mouth and find it sometimes hard to sit still in a dental chair and put that on a kid.
Right.
Especially a kid who hasn't developed all their reasoning skills and all of that kind of stuff and developmental stages. Even if your kid's brilliant, from the day they're born, there are development stages, and there are things that are very difficult to, even if they understand the words, they don't understand the feelings, and there's associations and experiences that they haven't had, and it makes it very challenging and very intimidating. And I'll tell you, because I have a feeling that we're going to get long-winded, so I'm going to say the point first.
Okay.
The most important advice I would give a parent bringing their kid to the dental office is 98% of children, the less you say, the better.
Oh, amen to that.
If
100%. If you only take one thing away, is the less you say, the better. Don't prep them for anything. Don't scare them for anything.
don't come tell me about your bad experience in front of them.
Mm-hmm.
Don't say big sister was traumatized. Don't, and I say that and I can tell you can tell that, I know you can tell that sometimes that gets annoying for us. I know it's meant with the best intention, and people are looking out for their kid and they want their child to have a better experience than they had, or their friend had, or their other kid had, or all those things.
Right.
And you don't always get the opportunity to speak to me privately. And so it's hard to tell me the things that you feel like you're advocating for your child without your child being there. But if I could ask you anything in the whole wide world is only speak positively about the experience in front of your child. Never tell your child about your own bad experience. And allow us to use the words and the terms and the positivity that we can use to frame and shape their experience. And we're going to include you and we're going to bring you along the way. But try to form your questions in a positive. Don't ask me in front of your kid if your kid's going to get a shot. Don't ask me.
Every time. I feel like it's every time.
Every time.
Every time.
I know you're trying to let me know that some care needs to go in with it because your kid's going to get nervous about it. Look, 7 out of 10 kids are going to get nervous about it. I'm used to that. We handle it every minute of every day. And your kid is special and your kid is unique and your kid is different. But I've been doing this for 22 years and any pediatric dentist has had training in this. And yes, if you feel like there's a unique situation for your child, try to get to speak to us individually. Like in my office, we have a treasure tower. So when I can tell the parent wants to talk to me alone, I say, hey, my wonderful assistant, could you please take so-and-so to the treasure tower and make sure they look at every single option to give me some time for you to get it out while they're not listening. So moving forward from that, we have options and levels of behavior management. Right. First, being in a pediatric office, and I'm sorry to all the general dentists, and I know that you are one of them who can be wonderful and do wonderful things with kids, but you'd be surprised at the number of people who just walk in the door, and when the kids see nobody but kids there as patients and everything's geared toward them, they automatically have a different vibe.
Absolutely.
And a different feeling of the environment.
Right, because it's like their place.
Yep.
It's not mom and dad's place, it's their place because everything's their size and themed towards them.
And my assistants do nothing but take x-rays on kids and work with kids, and so there's that. Now, you can get excellent care at your family dentist, and I'm not telling you not to, but that is the first step of behavior management is my office. When Michelle refers somebody to me, the first behavior management difference is the environment, right? So then from there, it is our treatment planning is different, which we've talked about crowns and stuff before. So our treatment planning is a little different. I have to be super fast at everything. So when we tell you your kid needs something like a crown and you've had a crown in your mouth, it's an entirely different process.
Completely.
So crowns for me are 5 to 10 minutes. Crowns for her,
about an hour.
With 2 visits.
Right.
So it's very different. So speed is the second form of behavior management. Then we have laughing gas, right? So we can do fillings or work on your kid with nothing. And then the next step we have is laughing gas. Also, the scientific term is nitrous oxide. And it's the little thing that goes on your nose, and there are different, styles and whatever, but they go over your nose and you just breathe the air, and I describe it to people, and those of you who are dentists or scientists, this isn't gonna be a scientific explanation, but it's dissociative. It's not putting you to sleep. It's not something that if you sit there and wait for the nitrous to work, you're gonna be able to just super tell. Sometimes your fingers will feel different. Sometimes you'll feel floaty. Some people feel heavy. Everybody's description tends to be very different. But a lot of what we'll see on the kids that are able, I have another form of behavior management in my office is I have TVs on the ceilings that are showing Netflix, and we let the kids pick what Netflix show they're gonna watch. And so if we can get the nitrous on them and get them watching the Netflix,
they don't know what's going on.
It's very, then sure, I get in their mouth, and after the shot, a lot of them will be like, what did you just do?
Yeah.
Or the ones who figure out what I did, it's a second or two later, like it's over before they're like, oh, I see what you did there, sort of thing, right? Does it help everybody? No. Do people still cry? Yes. But an effective nitrous oxide doesn't necessarily prevent crying. What it does is help you get over it faster. Predominantly what I like it for is it reduces your gag reflex. It affects that feedback loop. So when we put the big thing in your mouth to help you stay open, you feel a little less like you're drowning and gagging and gonna choke. So I use nitrous a lot, because once a kid starts gagging, talking them out of that and getting through that appointment is next to impossible.
Even an adult who you can reason with, once they start gagging, there's no going back.
Yeah.
No going back.
So I use it a lot to reduce gag reflex, if for no other reason. So then nitrous is great for my older kids, like maybe 5's young, but 7, 8, 6, 7, 8. The kids who are really cooperative, they're nice kids. They want to do a great job, but they're just a little white knuckly.
Yeah.
They're almost there. It's
I like
a
my
nice
kid.
Yeah.
My kid had it and did great. She was like, "This is good stuff. I'm doing great watching the TV."
Due to HIPAA, I was not going to comment that I have had her child on nitrous oxide, but since she said it.
The production crew has been everywhere. It's all good.
So they're for the kids who are almost there. Now, the kids who are doing very well but have a lot of work that they need, or the kids who are just super scared and they just want to do a great job but it's just too much, then we have oral conscious sedation. And that is our kid version of a cocktail.
Oh, yeah. It is a kid cocktail. I didn't even think about that.
Yep. We give them a little cocktail, and different pediatric dentists use different medications, and the most common being meperidine, which is Demerol, diazepam, which is Valium, hydroxyzine, which is also called Visceral, and midazolam, which is also called Versed. There are others. There are many others. A lot of people have or do use chloral hydrate. I personally don't use it, but I don't want to diss anybody who does, so I'm not going to go into that. But we use different combinations of those medications. I do not use all 4 of the ones I listed at the same time, but often I use 3 of those at the same time, and I give about half of the max dose for your first dose. I'm not going to like load up your kid and throw their dice. I give the lowest dose that is reasonably effective in my office, because when you drink something, it goes through your system and has to be metabolized.
Right.
And everybody's metabolism is a little bit different. Like if both of us take Benadryl, one of us is going to get more tired than the other one. I lose it. You lose it
I'm
too?
out.
Yeah, me too.
I take a kid's dose and I'm out.
So, I mean, we are alike, but other people. So there is that factor, how fast your metabolism is, how effective your metabolism is, what you ate yesterday. Lots of things factor into how effective it is, how much fat you have in your body. Some of them stick around in your adipose tissue longer, so a bigger, heftier kid is going to take longer to go through their sedative medications than a thinner kid, depending on the medication. So there's a lot of science that goes into that. The version is, it is the literal version of a chill pill, right? I mean, that's what we're doing. We're not putting them to sleep.
Yeah, it's not general anesthesia.
It's oral conscious sedation. I want them to still be able to talk to me. I want them still to be able to follow directions. I just want them to care even less than if they were on the laughing gas.
Right.
And the Demerol provides pain control when we use Demerol. So that is also an adjunct to the things that might be uncomfortable. Speaking of, don't tell your child they're not going to feel anything. Don't tell your child they're not going to feel anything. Because even when they're numb as numb can be, they're going to know if I touch them.
Yes.
They're going to know if I pull on their cheek.
They're going to feel pressure.
So when they expect to feel nothing, kids are very literal. And it scares the bejesus out of them when they feel something.
Right.
So just don't say they're not going to feel anything. Just let us do the describing and you do the supporting.
Right.
It's going to be okay. I tell parents to say, you know what, Bobby, I've never had Dr. Blume work on me before. I don't know how she does it. That's your best way. That's your best way.
That's a good, yes. That's a good lead-in, yes.
Yeah. So that's what I would say. And then finally, the next level of behavior management is general anesthesia, which is when your child is asleep. And there are different forms of that. Some people just do an IV, and that will be generally in a dental office. I have not provided that service in the past, but probably am going to start providing that service in 2022, where we bring in either a dental anesthesiologist or a medical anesthesiologist, and they provide the services of having the child actually asleep in the office. What I have been doing for the last several years is going to a surgical center or a hospital and having kids asleep there in that environment, which is, I love doing that, because I feel like I provide the most service to a child, because they get to be asleep, they get to not remember anything, and they come out with their problem solved. And I see kids with 15, 20 cavities and they're in pain, and I can solve that in an hour and a half with them asleep. In my office, 15 to 20 cavities is 3 sedations, and they're awake. And by the 3rd sedation, they're done. So it is a long haul. So I feel like I provide such a good service to the children.
Definitely.
When I get to have them asleep. And a lot of times that's the special needs community needs to be asleep. So don't ever feel bad if your pediatric dentist tells you your child needs general anesthesia. It's scary as a parent. My son has been under general anesthesia multiple times for illnesses. But I'll tell you, most of my general anesthesia patients end up being great patients later, because I never held them down, never scared the bejesus out of them.
They have no bad memory. You know, they're not going to be the adult in my chair saying, I had such a bad experience as a kid. That's not going to be these kids.
Yeah.
Which is amazing for me. So see how it ties in and how it keeps going. Yeah.
It really is. It's a really great service. It's scary for parents, but it really is. I'm so thankful that I can offer that. I was a general dentist for 9 years, and being able to feel comfortable and safe providing oral conscious sedation, and being able to be licensed to go to the operating room and do general anesthesia are the reasons I went back and specialized, because that was a service that I did not feel comfortable providing without the extra training.
Absolutely.
And that's really why I went back, and I feel like it's such a valuable tool.
Well, definitely making a difference in the life of a child has to be one of the best feelings ever. And especially, I think correct me, you probably know this study better than I do, but isn't like one of the number one reasons why kids miss school is because of dental pain?
Yes.
And so
more than asthma. More kids miss school due to oral pain than due to asthma.
So all these kiddos out there that are in pain and they've got a mouthful of cavities, being able to provide that service and change their life for the better is it's amazing.
One of my patients the other day, I've taken him to the operating room before, and he is special needs, but high functioning special needs. He's been with me for many, many years, and I'd love to say his name because I know he'd love to hear it, but due to privacy, I can't say it. But he was in the office just this last week, and he was asking me some questions about my personal life, and I was answering them, and he was just so matter of fact, and telling me that everything's gonna be great. And I said, I love you, and said his name, and he said, I know you do, Doc. And that's why we do this.
That's why we do what we do. It's amazing.
So, and finally, our last step of behavior management is gifts. We give you a gift when you leave.
Well, thank you.
And this is for you.
Oh.
And I got Michelle a gift because the holidays are coming up, and we're going to be doing some more of these. I wanted to give her some bling to wear in our holiday shows. So I got her some matching little champagne flute earrings.
I love them. It says sip, sip, hooray. Oh my gosh, I love it. Oh, thanks.
You're welcome.
I was being funny. And
She was such a good co-host today. She's getting a prize from the treasure tower.
Yeah, I know. I got to go to the treasure tower. Thank you. Those are amazing. Check them out next time. I'll be wearing them. Oh, those are fantastic. I love it.
So,
Okay.
well, thanks for joining us.
Absolutely. May your dreams be tropical, and
Cheers to
his
beautiful smiles.